Welcome to Table Talk, the podcast series where clinical experience informs optimal human function. I'm Romy.
And I'm Brandon, and our guest today is Joanna Prance. Jo is a fitness consultant, personal trainer, yoga instructor, and a mother.
She specialises in pelvic floor exercise and ostomy exercise, which is designed to help individuals who have undergone an ostomy surgery to maintain their physical fitness and improve their quality of life.
An ostomate herself, Jo is also a MASIC Foundation advocate and a women's health and wellbeing educator and mentor. The MASIC Foundation is the only multidisciplinary UK charity to support women who have suffered through severe injuries during childbirth, known as Obstetric Anal Sphincter Injuries.
Jo has been raising awareness about these subjects by leading talks, including at the University College of Osteopathy, which is how we first came to meet her. She's kindly joining us today to discuss life as an ostomate and her work raising awareness around childbirth injuries. So welcome, Jo.
Thank you for having me.
And thank you for coming. And it's lovely to see you again today, and very excited to, as we mentioned before, to capture things that we've heard you talk about in the past. So we wanted to just jump straight in and ask you how you became an ostomate.
Okay, so it's quite a lengthy journey to becoming an ostomate. So 2 decades ago, my son is going to be 25 this year. During his birth, I sustained what I was told was a 2nd-degree perineal tear. I now know I probably had a 3rd-degree tear. And that really resulted in a very lengthy journey for me, dealing with not only urinary incontinence, but also anal incontinence. And after all the other treatments had failed, which was over 2 decades, 3 years ago, I opted to have a colostomy to manage my anal incontinence. So in a nutshell, that's how I've become an ostomate.
Yeah, so it sounds like you've had such a long journey of, I guess, ups and downs, and having to kind of fight for your own health and be heard and be believed. And we were curious, because you mentioned in one of your talks that when you started experiencing these severe, we call them OASI, so Obstetric Anal Sphincter Injuries, when you started experiencing these symptoms, you weren't actually aware that this could be linked to childbirth.
No, and actually, immediately after the birth, even though I'd had the tear and I was repaired by a midwife, now it's quite an important point this, because if you have a 3rd-degree tear, you should go for a surgical repair. That didn't happen. I wasn't advised that my tear was that significant. The birth itself was pretty traumatic. My son was a large baby that hadn't been anticipated. So when I was induced, he was born really, really quickly, and that led to me sustaining the injuries that I had. One of the problems with OASI injuries is women just aren't aware to the extent that they exist, that incontinence issues, that perineal injury can lead to incontinence. And I was one of those women. I had no idea whatsoever that childbirth could manifest in lifelong incontinence, prolapse, a number of other issues, pelvic pain, and they're just not made transparent to women at all. And it's something I feel really passionate about, because if you went for any other medical procedure, you would be told to the nth degree what the risks are. But for some reason, we hide this from women, and we're doing a massive disservice to women by doing that.
Right, absolutely.
Oh, wow, that's must be a very difficult and scary experience to have to go through. Could you tell us a little bit about your experience as a patient, like after giving birth, and kind of discuss your experience in the continuity of care that came afterwards?
So, although it's like 2 decades ago, there were several things with the continuity of care, which in some ways there wasn't much continuity of care. So post the birth, I was repaired by a midwife. There was actually an argument over me about who was going to do the repair. There was a trainee midwife who was saying I should have had a surgical repair. I was never part of this discussion. There was no informed consent as to how my birth was managed. I was told I'd be induced, this is what was going to happen. But there was no discussion about the repair or the long-term implications. So I was repaired, and then I had a very swollen perineum, was very bruised, very battered. I had no idea. You know, I've never had a child before. I was only 22. I'd come straight out of university. I was a single mother. And so when I got told I could go home, I was none the wiser that there was anything really that wrong. And really, it was just the community midwife or nurse coming round. And mainly the focus is on the baby then. It's not so much on the mother. They would sort of have a look at the perineal area and sort of retract in horror, but never actually say to me, you might need to go back and have this looked at. You might have problems down the line. There was nothing. Nobody said anything. It was about a year after, that's when I started having problems with urinary incontinence. And it was because I had a horrible cold, cough, and when that went away, the symptoms didn't. So that was really the first time that I went back to the doctor. I thought, why am I leaking urine? I had a perfectly healthy bladder, pelvic floor, didn't have any incontinence issues. And that's when I started the first of a very long journey into discovering the joys of pelvic floor dysfunction, basically.
And you mentioned in one of your talks that initially doctors didn't really think that it could have been linked to the birth. I was just wondering what your conversation was.
Well, certainly from the urinary aspect. I mean, they basically said, you've got a weak pelvic floor. They sort of hinted that was probably because of the trauma from the birth. But then after very lengthy physiotherapy, which wasn't working, I had a load of other feedback treatment to try and stimulate the pelvic floor muscles to make me dry from a continence perspective, but that just didn't work. So I had a TVT mesh put in, which is a tape that holds up the neck of the bladder. So when you cough and sneeze, the idea is that you've got that support and you don't leak urine. It was after I had that I then started having problems with my bowel. And it was when I went to get help with that there was all sorts of other excuses made as to why, I had these issues. So, that the two weren't joined up really that much at all.
Right. And it must have been a really scary experience to think, actually, something's not right. How did it feel when you were kind of going through all of these changes?
I think particularly when the bowel problem started, it was really, really distressing because, again, I'm not one of these people who's left things. I've gone to go and get help. I know my own body. I was a really fit, healthy young woman, I've always been sporty. So to find myself having had urinary incontinence and now I can't control my bowel and I've got bowel urgency is really distressing. And so I did go through the whole round of physiotherapy again, but looking from the anal side this time. And that again took another year. It's a long-winded process. It's not a quick process. But I only really got referred after basic treatments didn't work. So things like giving me medication to either try and firm up the stool, stop you going as frequently, glycerin suppositories to try and empty the lower portion of the rectum, that type of thing. And none of those were working because basically the anal sphincter was damaged, the nerves are damaged, and I'm not getting the connection from my brain to say you need to go to the loo now. That reflex is missing. So it was very frustrating. So things like, you must have IBS or you've picked up a virus, because at that point I had to do quite a lot of overseas travel with the job I was in. And there were all sorts of other sort of things that were being considered, even to the point of insinuating I must have been incontinent before I had my son, which was the most mind-blowing out of all of the things that they could have tried to make reasons for why I had these problems.
Absolutely. It doesn't seem fair or just or make sense, really.
No.
And when was the, I guess, that moment where people started putting things together? How did that conversation go?
Well, that didn't happen for years, quite frankly. So after I had all that sort of more physiotherapy from the bowel perspective, I ended up having another surgery, and this time it was to try and repair a rectocele, but from the anal side. And that sort of worked for a little while, but then about 18 months later, the problems came back. It was before I had that surgery when I was thinking, well, something really isn't right, that I'd gone back to the hospital where my son was born, and the consultant that had put the mesh in was no longer there. He'd gone somewhere else. He'd retired. And there was a new consultant, and I said to him, I want to look at my birth notes. I want to see what's happened. I was convinced that something had gone slightly awry. It wasn't as straightforward as a normal vaginal delivery. And they got the notes, and there wasn't anything that really showed that anything wrong had happened. However, there was a few things missing from those. And he intimated that basically I'd had a traumatic birth, that my problems were psychological. I wasn't having these physical symptoms, that I just needed some counselling, a good cry, some boxed chocolates, and it would all go away.
Wow.
And I left that room really demoralised. It was at a critical point because you have 3 years if something has gone wrong for any sort of legal claim or negligence claim. And I think they knew that. I think they were worried that's where I was headed. And so he wanted to shut it down. And the quickest way to shut it down was to tell me my problems were psychological. When you get away much further down the line, 5 years, 7 years into my journey, you should have had a cesarean. You shouldn't have had that delivery. You know, it's almost the other way round. Everything's blamed on the birth. But that's because my window of opportunity has gone, and different hospitals are no longer responsible for me in that way.
That almost comes down to a legal thing as opposed to anything else.
Yes, and it's that fear factor that, you know, oh, is she going to sue? Is there going to be a negligent claim here? And I really believe that his attitude was very much, we're going to protect our own in this one.
Wow. Yeah, and given all of these referrals and complications and shifting around between practitioners, what do you feel needs to change in order for the patient handling in the UK to improve?
Well, I think in general, you know, my story is quite a long time ago, but the reason why it's still relevant now is that this injury is still happening and women are still suffering and they're being told their problems are psychological. Even people who are medics who've experienced this injury, when they've gone to their colleagues and know things are wrong, their colleagues have said, oh, no, everything's fine. And if you have a medic who knows about maternity, like midwives and GPs and things, and they're being told from the front line that they haven't got these issues, I don't know what hope the layperson has when they're trying to get help. I think it's education. So educating women antenatally, make them aware of all the risks. There are things that you can do to help. So things like perineal massage, preparing the perineal area as you're approaching your delivery. Make them aware of the risks. I think when it comes to interventions, now I didn't have forceps or ventouse or any of these instrumental things that we know can increase the risk of the tears. But I think understanding what the effect of having those involved in your delivery needs to be explained more too. And then if you have a tear, what to look out for, you know, how do you care for it? Because quite often when you have these perineal repairs, they can often break down as well. And then you can't go back in and have them restitched. You have to basically wait for them to heal. And obviously your best window of opportunity for repair is at the time. So the longer you get away, the harder it is to actually repair this injury. And the success rate starts to fail as you get further and further away from it. So if you think about my first bowel repair, my son was probably coming up to 3 at that point. And then the efficacy starts to wear off. And it's really hard then to try and get a good result, particularly with these sphincter injuries.
And in the meantime, you're living with all of these other symptoms.
You're living with all the other symptoms, yeah.
It's all of those days and days between referrals and appointments that you have to live with.
You feel like you're in a never-ending waiting room, put it that way. And then as different treatments are suggested, you pin a lot of hope on that they're going to work, and when they don't work, it's really disappointing. And I think even now, you know, even in that, say that consultant had reacted differently when my son was 3, I don't think I could have ever seen that I would have ended up with a stoma 20 years down the line, even then. It just wouldn't even have occurred to me. That's, you know, how long the journey would last, and that would be the outcome.
Many women seem to feel symptoms that they know aren't right and feel dismissed by the healthcare professionals that they talk to. And I was wondering if you had any advice about how women can better advocate for their own health.
I would say just keep persevering. Find somebody who will actually listen to you. It's so important. You know, it's incredibly hard to talk about the fact that you cannot control your bladder, let alone your bowel. You know, saying you cannot control your ability to, you know, go to the loo and you're having accidents. It's a really hard thing to say. However, you do need to try and keep persevering, get somebody to listen to you, even if it means you have to go and see another GP. And this goes back to, you know, what else needs to improve. I think awareness from primary care all the way through the system. I mean, even in maternity and in midwifery, there are some people who will deny that these 3rd and 4th degree tears are as significant as they are for the person in the long run. You know, there are some doctors that are doing repairs who are very dismissive that a 3rd degree tear can possibly mean that somebody's going to be battling with incontinence years down the line. I think the fact that not all injuries will manifest with problems instantaneously. So some won't manifest until a woman reaches perimenopause or menopause, when the hormone levels start to drop. You get there a drop in estrogen, and all of a sudden you can start to find that actually you're having real problems with urgency and control. And again, that's looking at obstetric history is really important. It's often overlooked, a bit like my situation was in the early days. You're steered almost towards the IBS route or inflammatory bowel disease or other causes, but you need to look back and see what the obstetric history was, because there is often a correlation between what happened then and these symptoms that appear later.
Absolutely, that makes a lot of sense. That we shouldn't be excluding that part of someone's life when it's just so significant.
It's a massive event, you know, and even if somebody has had sort of vaginal delivery and then gone on to have C-section second time round, it shouldn't just be dismissed what happened earlier on.
Absolutely.
And I wanted to kind of dive into your work at the MASIC Foundation. It seems you've been involved in a number of projects, like empowering women who've been suffering with these childbirthing injuries, and as you've been highlighting, that education is kind of the main focus. Like, how and why have you become involved in these projects relating to this cause?
So I found MASIC in 2019. There was a consent for birth meeting which MASIC were running, and it was all looking at the Montgomery Review and consent to birth and how women are supposed to have informed choices about what was happening in their birth. And they had a couple of advocates from MASIC speaking who were talking about their journey from their injury and 3rd degree tears, 4th degree tears, anal incontinence. And I felt really inspired by their stories and hearing them talk about it, but also hugely frustrated because actually things hadn't moved on. And throughout my journey, I never met anybody else who'd had my injury. You know, I always sat in these continence clinics looking around, surrounded by older people quite often, never seeing anybody young, and thinking I was like a unicorn, you know, I was this rarity. I had no idea that there were other people out there with these issues.
And that's very isolating in a lot of
It's
respects
hugely
as well.
isolating, and that's one of my motivations to speak out about it, to be involved with MASIC, to support other women. And I thought, well, I've had a crazy journey to get to where I have. I've got masses of knowledge too, and if I can share that and make people aware of the long-term implications, then for me that is, you know, that's turning something positive out of what has been quite a negative experience at times. I try not to look at it that way, and I am a very positive person, but undoubtedly it has affected every area of my life, from working to my relationship with my husband. I have an excellent relationship with my son, but, you know, there are certain things where he's well aware of problems with women's health, which he probably shouldn't need to be at that age, but he is. He knows all sorts of stuff, probably more about childbirth injury than a lot of people.
So if you could just share a few links that you think would be useful for listeners.
Yeah, sure, that would be great. So the first one I'd really like to share is the MASIC Foundation, so the charity that helps women with OASI injuries, hugely supportive organisation trying to make change in healthcare too. So that would be masic.org.uk. And then if anybody wants to get in touch with me, my website is www.joprance.com. But yes, I just feel like women who have this injury, we lose out in lots of ways, and you can't necessarily repair all the things that you've lost in life through this journey and this injury. I'm lucky I have a good relationship with my son, but a lot of women don't. You know, they resent what's happened to them, and there's huge psychological problems with it, which you can imagine, mentally challenging, dealing with body that doesn't work for you in the way you want it to, and you can't have that freedom to just go out without worrying where a toilet is. You know, you take for granted how many times you might just get in the car or commute or go to a social event, and at the back of our minds all the time is what about the loos? Where are the loos? And actually that anxiety can also make the situation a lot worse. So anxiety, your bowel is driven by anxiety as well. So it's more likely to be active at the times you don't want it to be if you're driven by stress.
Yeah. It reduces your life and your experience of things so much. And just to come back to resentment, it's an interesting topic. I was wondering if you could elaborate on how you overcame that and forged such good relationships with your family.
So I don't ever resent my son at all. It wasn't his fault in any way whatsoever. My priority for him was to be the healthiest version of me that I could be. I wanted to be a normal mother. I wanted to throw the rugby ball around in the garden with him and do all those really active things. And, I think because I'm such a sporty person myself and my son was sporty, that was hugely important to me. I've had pretty much treatments every 18 months since he was small, up and through to having my stoma. I think I've only had ever about 2.5 to 3 years clear. And this last 3 years I've had is probably some of the clearest I've had in terms of being free from medical appointments. So I just feel like things are getting back on track. But when I think that he came to my graduation when he was 6 months old, and then I went to his graduation last year, which was delayed because of COVID by a couple of years. And I just put the two together in context, and it's taken my graduation to his graduation to get to this point. So he's pretty much grown up alongside my journey. And each year that he has another year where he is footloose and fancy free, I love it.
Hopefully he'll be a better advocate for the cause by knowing what you've gone through and what the risks are, and he'll hopefully be a better father one day if he wants to. And I think we need to raise that awareness and those conversations, already among women, like with MASIC, but with everyone.
I think that's something that's really missing. So there's not really anybody for the partners or the people surrounding these women who've suffered these injuries to really talk to. They quite often have to be the rock. Like my husband, he's been the rock. But there's been times where he could have probably really done with somebody to talk to about it, who would understand the situation, somebody else who's actually got a partner or a wife, girlfriend, somebody who's suffering in the same way, because only they can really get it. It's not something you can talk with your friends. So I think it's a massive strain on them too. It can really take its toll.
Yeah, well done for managing to persevere through all of these things and bring up such a beautiful family. That's very impressive. Going back to some of the populations that you work with within the MASIC Foundation, what are the kind of common challenges that you face when working with this population?
Well, we don't have one problem, put it that way. We have multiple problems. So, you're not just dealing with bladder and bowel issues. You're dealing quite often with structural problems with pelvic floor dysfunction, so often accompanied with prolapse as well. Sometimes you've got separation of abdominal muscles still, which haven't healed properly, so rectidiastasis. It is complicated. A lot of my knowledge, you can go on as many courses as you want, but a lot of my knowledge has been accrued from having to rehabilitate myself, learn myself, what works, what doesn't. We still need to have strength and be able to do, everyday things. And I think that's really important. So as part of trying to be active, it's allowing people to have the skills to do things like lift things. You've got a small child, lifting a small child, all that type of thing. Children get heavier as they get bigger, but unfortunately what tends to happen for women in our situation is their prolapses are getting worse as their child is getting bigger. So there's a lot to think about, there's a lot to consider. Timing, a lot of women, if they're having to manage through, say, rectal irrigation or other methods to clear their bowel, it's finding a window in the day where you can actually exercise. I mean, that's before I had my stoma. My window of opportunity for exercise was getting smaller and smaller because I was having to irrigate morning, I was having to irrigate in the afternoon. It was affecting my teaching. It was my life was centered back around the loo again, which is why I wanted to have the stoma. I'd irrigated for 4 years and tried a number of irrigation systems, and it worked quite well up until the point where it didn't work anymore. So then I was left with having a stoma.
So we just kind of, I think we finished off when you were talking about your own story around the time where things started coming together, you started becoming bowel incontinent, and then things start getting a bit more looked into and put into in relationship with your childbirth experience. Can you tell us a bit about what happened next after that then?
Yeah, so after that first bowel repair that didn't work, I then had moved down to the south of England because I was up in the Midlands originally, and I ended up going back into the hospital system down in the south, and it got to the point where, well, you've had two quite sort of interesting surgeries already, one being the mesh, which again hardly anybody knew much about because it was right on the time where the TVT mesh was being used. So they didn't really know about the long-term problems with TVT mesh, which unfortunately I also happened to inherit. And so I got referred into London in the end because they didn't want to just give me another repair for fear of making things worse. And at that time, there was these things called neurostimulators, which seemed to have some effect on giving you some awareness of being able to know when you could empty your bowel. It would give you that sort of sensation that there's something there that you might want to go. And so I got worked up and trialled to have this permanent device put in. So I had one of those put in. And again, the efficacy of that was about 18 months. But then the devices themselves, maybe it's because they're in their infancy, but they were quite temperamental. The leads fractured, which meant that they stopped working. And I pretty much knew overnight when it stopped working because the symptoms were back. I was really careful. These devices are very similar to pacemakers. So you've got a battery that's implanted in your buttock, and then the leads from that travel through to the sacrum, and they go into the sacral foramen, and they deliver the current through there. You've got an external programmer, a bit like a mini remote control or a mobile phone, and that controls the current. And you're given a number of programs, and you're worked up to finding a level of program that's going to work for you. The idea is that the batteries last quite long now. I mean, when I had mine, they had a life expectancy of about 5 years, but the problem is I never got to that because the leads themselves were very temperamental. And then I kept getting shocks from one of the devices, and I had about 6 procedures in the end over a number of years to try and get it to work again. But each time it was another general anaesthetic, which wasn't ideal. And then depending on what they'd done, I then had to take some time off work, not driving again, letting it all settle. So it was quite disruptive. And then I wasn't feeling like I was gaining anything much from that treatment anymore. So that was when I started to irrigate. So I had the last device probably taken out in 2013, I think, was the last one. And the first one had gone in around 2008. So over that period of time, sort of persevered with trying to get them to work.
Yeah, it's a long journey. It's a lot of invasive procedures.
I've had 17 operations, 17 general anaesthetics, and that's not great in itself. And each time I've tried to say, can I have something done locally? And they're like, no. And I am not a person who enjoys morphine or any of those drugs. I really hate them. They hate me. So, for me, it's probably one of the worst parts of it is having to keep going through another anaesthetic.
And was there ever a point where you felt like your body wasn't yours, like it was working against you? Did you ever feel that dichotomy?
Oh, yeah. I mean, even now, I have to work. I think the way I've done it is I've spun it on its head. I have to work with my body. I can't work against my body, put it that way. I've learned to sort of work with my limitations and all the little things that I constantly am battling with. So my stoma gives me great freedom because I've got that control back, but it doesn't fix all the previous stuff I've had done in that way. So I have niggles from where my neurostimulators were. I have all sorts of imbalances with muscles. And I know one of the things you're interested in is sort of how osteopathy can sort of help in this situation. And I have been seeing osteopaths before because I've had these muscle imbalances with my adductor being over tight on one side and then something else tightening up, and it's all connected around the pelvis area on the whole, connected into pelvic floor. So sometimes you get one side of your pelvic floor that's too tight, and all of this has an effect. And talking about challenges with working with women with these injuries, they're all the things that you're sort of trying to battle. You free up one area and another area tightens up. And you've got to be careful not to over-tighten the tight areas.
Yeah.
So, yeah, it's like a bit having a knotted ball of wool, and you sort of unpick one bit of it and then another bit tightens up again. So you're trying to find that balance. What I would say is I'm really spent a long time trying to rebalance things like my gluteal muscles once the battery was out, because my right glute was pretty weak after having those batteries in there. And also when I had the devices in, I didn't do anything like yoga, because I really tried to look after them. So I thought, if you're doing lots of flexion extension through your lower spine, through the lower lumbar, not ideal, it might pull the leads. Avoided rotational movements and stuff like that. I did swim, but I didn't do things like row, and I love indoor rowing and things like that. So they're all things now that I can do, and taking up yoga. So, in fact, since I've had my stoma, I've been able to qualify finally as a yoga teacher, because I've been able to actually attend the course without having to worry about where the toilet is and being on the loo all the time.
Absolutely. Yeah, that must be so freeing. You can finally just be the person that you are without having to fight against yourself. You know, that must be a really big achievement.
It is. I mean, the other thing which I never thought I'd ever get back to is I've always wanted to return to something competitive. You know, I feel like a lot of my prime years of where I could have really been great at something have been lost to a certain extent. So in 2021, I decided that, I mean, I had been swimming before my stoma anyway. Going into my stoma, I was fit. So despite all of this, I've always kept myself very active, very fit, trained at a reasonable level, put it that way. So my upper body strength's been good. It's been harder to keep that going when you have less time available to you that you can actually fit that in amongst being on the loo. But I returned to competitive swimming, and I joined a swimming club, and it was quite a daunting experience, because although I'm very confident in the fact that my stoma wouldn't leak and the rest of it, it was just that fear factor of the unknown. You know, would I be good enough, and would I fit in, and all these other concerns. Now, I literally do front crawl. I don't do lots of other strokes, and again, some of the drills I have to sort of modify. I have to be careful not to do too much kicking, because that sets my glute off. So I'm constantly finding ways around trying to juggle stuff in my body. However, I've really enjoyed it, and I competed at the weekend in a 1500 race at K2 in Crawley, and I won my age group, so I was really chuffed.
Congratulations. And 1500 is a long distance. I used to swim competitively as a kid, and the 1500 and 800s are far. really
well,
tough.
I'm not really built for sprinting, and particularly after all the stuff I've been through, I'm very much aware that as much as I'd love to go on a full-out sprint, it probably would just cause me a few issues. So I'm always sort of just swimming about 70% of my maximum, which is not very conducive when you're trying to sprint. So longer distance is probably going to be my thing. And having done an 800 last year for the first time, and then this 1500 was quicker this time than my 800. So I was really chuffed.
That's really impressive.
So onwards and upwards with the swimming is what I say.
Absolutely. So how did that journey evolve from the exercise you were doing, I guess, before you gave birth? Then during that journey, you had a bit of a dip, like you mentioned, and then how did your exercising change when you became an ostomate? And what has it been like since then? How do you train? What was your approach?
I suppose before I had my stoma, it wasn't that I wasn't training. It was just the times that I had free to train were getting more and more restrictive, because obviously I was trying to fit it in around irrigating, knowing when I could leave the house securely, that type of thing. I have worked from home for quite a while, so that has helped. So I've got my facilities at home, I've got my gym at home, and that has enabled me to carry on training to the level I am, really. It would be quite tricky if I was going off-site and trying to do the level of training I've done. I think in terms of time of day, what having or being an ostomate has done for me is it's enabled me to go back to teaching first thing in the morning, which I wasn't able to do before. So I've got more time back. In terms of my training, it's given me greater flexibility, but I now have other challenges. So I've got to then think about, when is my stoma not going to be active? Because I don't really want to be training on a time when my stoma is active. So for me, I wouldn't do my training first thing in the morning. Midday, later in the day is probably what suits me better. 'Cause first thing in the morning, she's busy.
Well, that's a good. I mean, I just want to touch on that actually, because she's a she.
She is a she.
And she also has a name.
Yeah,
and
she
I
does.
I wondered if you could talk about that.
So when I was looking at having my stoma, I thought it was really important to involve my partner, and I would say that's probably a key thing for anybody who's looking at this. I know there's some people who might want to think that they want to do it all on their own, but actually it's really important that you try and involve whoever's in your life with you. And we were looking at the images of what a stoma looked like. They're all quite weird and wonderful looking. And he's saying, oh, it looks like an anemone, a sea anemone. And so it had a name even before it was created. And it's just stuck ever since. So I had my stoma in December 2019, and so I have 2 birthdays a year. So I celebrate her birthday as well as my own birthday, which means I get 2 lots of cake, which is even better.
That's the main reason, really.
Yeah, so
it's wonderful because you've I guess she belongs to you now, and you've accepted her.
Yes.
And I think it seems from what you're saying that is such an important part of the journey.
It is. It's acceptance. I mean, I was lucky because I had time to plan for my stoma. It wasn't an emergency situation where, you wake up and there's something there and you hadn't anticipated it. I think that would be, and it is, very shocking for some people. You haven't had any time to mentally adjust. And even though I knew what was involved, and I had done research in the past, because the idea of having a stoma was mentioned at around the time the neurostimulators failed. However, the surgeon wasn't overly positive about stoma. He was saying, I wouldn't really want to put one of those in you. And it sort of had quite a negative connotation. So I was thinking, God, it's got to be horrific, this thing then, if he's saying he doesn't really want to do that. Mm. And I didn't know if that was from an aesthetic perspective, because I was a bit younger then. However, it's been such a positive thing. And I still think, in terms of raising awareness on stomas, they are life-changing and they are saving people's lives. So if it means that the difference between being here and not being here for some people, I think most people would choose their stoma. Right. I went to a Stoma Awareness Day on Sunday, which was the first of its kind I've been to, because since COVID there hasn't been much around like that, and it's one where you can go and see different products, and they have stoma nurses there, and they're really good to go to. And it's interesting just hearing how people's journeys to stoma have materialised and what they've gone through. But very few people ever associate childbirth injury with a route to stoma. They assume you have Crohn's, colitis, cancer, those type of things. So
yeah, and what were your preconceived notions, or what did you know about stomas before you had one fitted?
I knew quite a bit because I used to work in cardiac rehabilitation, so I did that for 13 years. I had a bit of a hiatus from fitness around 2016 because I was in a bad way with mesh and prolapses and lots of other issues. So I took a desk job, but I also, towards the back end of working at cardiac rehab, had come across a lady who I noticed she had a stoma, or she was waiting to have a stoma, and she and I actually formed quite a friendship, and from that I learned a lot about stomas and the complications that can arise from stomas too. So she'd had both sorts, so I don't think we've actually talked about what a stoma is yet. Probably a key thing here. So a stoma is a surgically created opening on the abdomen, and its real purpose is to divert waste, so either urine or feces, out of the body, and it's collected in a bag. But by creating a stoma, one of the problems is you are basically got a weakness in the abdominal wall, so sometimes the intestines can protrude out from that, and that's known as a peristomal hernia. So you can get a bulge or a swelling around the stoma site. My friend who'd had both an ileostomy and then it was changed to a colostomy had quite a significant peristomal hernia. She was a lot older than me. She's in her 70s. But it was huge, and actually I found it quite terrifying when I first saw it because it was so large, and she did end up having to have quite big surgery to repair it. So I was well aware of peristomal hernia. Having said that, there's lots of people who have peristomal hernia and they have perfectly, active lives, and that's the important thing to say, that just because you have peristomal hernia doesn't mean you can't be active. However, you do need to support that hernia. It's a really high risk of having a peristomal hernia if you're an ostomate. So my surgeon warned me that 70% of ostomates will get one within the first 2 years. So what do I do to try and mitigate that? Well, I'm absolutely fanatical about wearing compression. So in terms of my underwear, I'll wear compression garments. I generally have a layering system for compression. So the more strenuous the activity or the heavier the lifting and that type of thing, I will maximise the compression. Problem with compression, and it depends on how active your bag is as well, or how active your stoma is. If you compress too much, then you're at risk of leaking because there's no room for your bag to have the contents in it if you're squashing it. So that's why my other thing is to try and fit in my exercise when I know my stoma is not as active. Which makes sense. I mean, you wouldn't have a massive meal and then try and exercise anyway, really. Yeah. And I think that's the other thing when it comes to stomas. Certainly for me, because my bowel function was pretty normal, other than the dysfunction at the end where the sphincter damages, my bowel probably would behave in a similar way as if I didn't have the stoma, except I've got the control. So it's fairly predictable, but not everybody's stomas are like that. And I think that's one thing that's really important to stress here is every stoma is different and every ostomate is unique and you can't compare. So we all have different things that we have challenges with.
Yeah, and I guess that makes it very difficult in terms of finding randomized controlled trial for research-based stuff, just because every person and every case is going to be drastically different. So you really need to have
If you take something like stoma products, like stoma bags, everybody's skin is different, so we don't all use the same moisturizer. And the same happens with stoma bags. So there are so many different bags out there, different adhesives. Not everybody's skin is suitable to the same adhesive. Some bags will stick really well on one person and they won't on another. And so the journey into being an ostomate and having bags and trying all this stuff can be quite a surprise. I mean, the stoma nurses are generally very good because they'll guide you. However, I was in a fortunate position and I literally ordered loads of bags from different companies before my stoma, stuck them to me. I actually did like patch tests on my forearm to see if I had any irritation from the glue. And I did actually find one bag company which my skin really didn't like. So the thing with that is if I then had that bag with my stoma, the skin around your stoma is so important to look after because you've got to have something stuck on it all the time. And so you're trying to minimise the irritation. What I have found over time is sometimes my skin is more sensitive to chlorine and sometimes the glue interacts with the chlorine and that can cause me a rash. It almost looks like sunburn around the outside. And again, it's trial and error, finding what works for you.
It's a really good point, though, for people who either are doing elective stoma surgeries or who undergo them from one day to the next without being able to prepare. I mean, it's always good to be able to, if you have the time, to experiment with things before you go into that, to know what works for you, because, like you said, everything's so different.
I mean, for me, my primary focus was to get back into the pool and get back swimming again. And so I actually spent 2 weeks where I wore a bag all the time, because I knew that's what it was going to be like if I had the stoma, that you can't just say, I don't want to wear it anymore, take it off. And it was really alien to have something stuck to your abdomen all the time. And it's a bit like somebody who's stuck a sticker on you and it gets itchy, or you've got a plaster on and you want to take it off. And to start with, it was really, I was like, I don't know if I'm going to be able to keep this on. But I made myself do it, and I made myself do all the things I would normally do, so I could see how my clothing worked, and I learnt masses. So by doing that, it made me better prepared, and I knew what was going to work. So when I wanted to come back to exercise post-surgery, I was in a much better position because I'd done all that research.
Wonderful. Yeah, you were prepared.
I was really
That's
prepared.
Wonderful.
Yeah.
So, in your case, I don't know if this is if the majority of people have this experience, but I was quite surprised when you mentioned that acquiring a stoma was extremely freeing. It was a very joyful day, and I was just wondering how that came about, what those feelings were, and how they've evolved over time.
So yeah, I mean, for me, that was my experience. There would be a lot of people who would probably say, oh, I didn't feel like that at all. There were wobbles in the run up to the surgery because, yes, my stoma could be reversed if I wanted it to be, but I didn't really want to have to undergo another surgery. And again, you know, I think with the best will in the world, say I really hated it, I would have had to kept it for at least 18 months. And I literally got my stoma in just before the whole COVID thing. So the chances are I would probably still have it now anyway. For me, it was all about trying to embrace the possibility of a more positive existence, a more positive life. My surgeon was quite balancing in the fact, he said, you know, there are going to be days where it's not so good. And, you know, he was very levelling in that way. If I was buoyant, he would try and bring me back down to earth a bit. But I think going in with a positive mindset really, really helped. And at the end of the day, I've been dealing with feces for years, put it that way. You know, for some people who haven't had to be dealing with that, it's quite different. But for me, it's just dealing with that, but in a much neater way in some ways. Yes, it sometimes leaks and it's messy. However, it's not messy every day like my life was before. And that's what you've got to factor in. And some days I think, oh, Christ, you know, I have got this now forever. But then I think, well, so what, you know? Where would I be without it? And I think, as you know, I'm 47 now, but where would I be in my 70s if I was still existing in the previous Ray? You know, a lot of people end up in homes because of incontinence. At least if I did ever have to have somebody look after me, having them look after my stoma is a lot easier in some ways than, you know, trying to deal with other things.
That's a really interesting point, actually, because, yeah, it can... you're shedding some new light, I think, around this. I think we weren't very familiar with stomas before hearing you speak, and I think it's really important to break that stigma that it's the worst thing that can happen to you, because sometimes, actually, it can just increase your quality of life so dramatically. One thing that you mentioned before is that it's given you more time, you know, and that's so profound. Yes. I was just wondering if there were any more tips that you would give to ostomates who'd like to be more physically active, because you mentioned compression and not exercising in the mornings, maybe so much if that's what their rhythm is. I was wondering if there was anything else in terms of advice that you'd give.
I think in terms of time of day, that's completely unique to each ostomate because of their routine. You know, some people have a stoma that's emptying pretty much all the time. It's very tricky. I would say depends where your starting point is and what you're wanting to achieve. Really, you've got to build up gradually. And if you haven't done anything about your posture or trying to work on your deep core muscles, then I would start with some very gentle exercises. And there's lots on the internet that are out there with that. Then for me, post-surgery, I always start walking several times a day. And it might only be 2 lampposts to start with. Then I increase, I have to always go back to basics, and each time it's a bit like Groundhog Day. But I would say you have to start off gradually, and say you wanted to go back to something like badminton or a racket sport. Think about the movements that you need to do to go back to those. So some of those are quite overstretching, reaching movements, and I suppose you want to find ways of replicating those on a less intense scale to get your core particularly used to those movements. So for me, I do this thing called mindful movement, and that means being consciously aware of making all your movements count no matter what they are. So whether that's active daily living, from what you're doing in the home and your housework to gardening, how do you make those movements mindful so that you're looking after your stoma, but you're also looking after your posture on the whole? And that's one of the things I like to try and do with my clients as well, is connect how we move from floor to seat to standing and make it all count.
I think many people outside of the ostoma population would benefit from that as well. Actually, some conscious proprioception would be very beneficial. Just to draw back to your experience of having a stoma, and you mentioned that you had very good stoma nurses that gave you a lot of support and help through that. What kind of other support did you receive once it was placed, and then the period following that?
Well, it's not a huge amount really. I mean, basically you have your stoma nurse, and then it's essentially, unless you have problems, then I haven't seen a stoma nurse for 2 years. First time I saw one was on the weekend, purely because I happened to go to that stoma wellness day, and it was useful for me to ask some questions that I had been sort of there for a while. I think on the whole, that's what happens. You have your stoma, and then unless you have problems, you sort of are left adrift. And I think that's probably where it's harder for an ostomate who's maybe had a stoma for a long period of time, but has been very fearful of going back to anything active. And that's where it's really important to start off gradually. And I think there's massive misconceptions that you can't be active when you can't do certain things with a stoma. I don't think we went through the different types of stoma, even though I described what a stoma was. So you have a urostomy, so that takes waste of urine out of the body. So that's one form of stoma. I have a colostomy, which pretty much means I've got all of my digestive processes going through. So it just diverts away from the lower end of the rectum. So in terms of nutrition, I pretty much get a normal diet, although there are things I don't eat. An ileostomy is much higher up. It's from the small bowel, so of course there's less time for them to absorb nutrients, and their output tends to be a lot higher, and it's more liquid. So colostomy is more normal sort of poo texture. An ileostomy would be more liquid, but that's very generalised. So you can get people who've got all sorts of consistency going on. But yeah, very basic terms, they're the differences between the different stomas.
And we've been talking about all the things that you can do with a stoma. Obviously, there are some challenges, and I was wondering if you could talk about some of the things that you faced that weren't so pleasant.
So probably, well, I say sometimes the bag does leak, and depending where you are, that can be a challenge. Not everywhere has nice, accessible toilets. And things like sort of smaller pubs and things where you may have cubicles, but there's no sink in the actual toilet compartment, and then there's not a decent bin. And I actually think this is probably a situation that affects men a lot more than women, particularly dealing with this. There's been a lot about, lack of bins in men's toilets. And so for men with these problems, or even having any sort of privacy or space, having access to a sink is probably quite useful, especially if you've got a very messy stoma to deal with. And it's having the privacy to be able to deal with that. Likewise, having a shelf to be able to put your stuff on, or a hook. Quite often you have a big room, but then none of these smaller things that have been overlooked. Some people rely on needing a mirror to see how they put their bag on their stoma. So these smaller things can make it a lot easier for an ostomate when they're out and about. So having some hooks and a mirror and a shelf and access to a sink as well.
That's great. I mean, even for us who are, it's terrifying to say this, we started this when we were in our first year. We're now in our third year, graduating next year. When we go off into our clinics, our practices in about a year's time, it's good to know what facilities we want to make sure we provide in terms of accessibility, because we often think in terms of that, we need obviously wheelchair users to be able to get to our clinic, but what about inside of our bathrooms? How does that work? So that's a really, really interesting point you've made there. And it's interesting how, I guess, you make things work, but as a society we can definitely help ostomates have a nicer experience of life. So thank you for speaking on that.
I think if you think about most toilets, a lot of people will think, I don't want to go in that loo. And then if you've got this to deal with as well, it's more challenging still.
Yeah. Of course. Yeah, and you had previously mentioned about how partners and things like that can help support and add a level of emotional and physical support to some degree during this process and living with a stoma. Could you kind of, I guess, give a direction on how someone would best support someone who lives with a stoma?
I think that's really difficult because it depends on your relationship and how open you are. You know, my husband and I are very open with each other. He's been on this journey with me, and you know, each time we think we've come to the final treatment and there's been something else. So maybe our relationship in that way is fairly unique. He's very supportive. I think even if your partner isn't really expressing or talking about having a stoma and they need one, even if you look at the information yourself, there's plenty of information out there, you know, just educate yourself about it, and then hopefully at some point they will want to open up and talk to you about it. It is important, you know, there's no getting away from it. When you're in an intimate situation, you've got a bag there. There are ways you can sort of, you know, cover it up and things like that, but for some people, I think that's a massive confidence thing as well, you know, having this thing stuck on the outside of your body, and how you deal with that. Misconceptions, you know, we all smell, we don't all smell. Okay, you know, if you go to the loo, it's going to smell in there. If we take our bag off, it will smell in there. It's the same sort of thing, but we don't all smell. I mean, there's so many deodorizers and other stuff now and things you can put in your bag. If you're worried about that, then, you know, you don't need to worry quite as much.
There's lots of ways of managing.
There are ways of managing it, and you know, stoma products have come on leaps and bounds. You know, compared to 20, 30 years ago, and there are masses of stuff. It's a huge market.
That's a big relief to be able to have access to those kind of products, right? Yeah. Wow. Thank you very much. For
and I think, you know, that's the other thing. A lot of people don't realise there are more bags out there than maybe the one they were assigned with originally, and so they just stick with that, and then they don't know that there's other stuff that could be helpful for them.
Are these range of bag selections all available via the NHS, or do they have to be done privately?
Depending on your area and the stoma nurse, essentially the stoma nurses on the whole could prescribe any bag. It just depends which ones they're affiliated with. In some areas you'll find that they're very I can't think of the word now. You know, they might follow a particular brand, whereas others will be more open to an array of options. I mean, mine was pretty good. So she said, right, well, these are three of the main ones. Then I went off and researched online, and they're willing to send out samples. So that's what I did. I phoned up and explained the situation, explained what I wanted, and they sent them. And that was really helpful.
That's brilliant. So the support is there. Sometimes it's
support is there, but you do need to be proactive and do a bit of research yourself.
Right, absolutely. Yeah. I think that's a really valuable thing that you've kind of brought up today. Is the more prepared you are, the better the experience can be.
I think the other thing would be obviously depending on what the prescriptions are like in different areas as well. So generally, you have an appliance company that may deliver your products to you. There are lots of appliance companies, and obviously, as an ostomate, you're quite a valuable commodity, particularly if you've got a permanent stoma. You're going to always need these products, potentially. So there's a competitive market out there for it. So the way I see it is, you know, I deserve to have the best of the stoma products out there that suit me for what I need. You know, I'm stuck with this now, so I want what's going to work best.
That makes sense. And for women who have undergone an OASI, what advice would you give them if it's just occurred? Where would you point them to? What would you tell them?
I think it's really important to highlight here too that a lot of women who end up with stomas end up with them pretty soon after the delivery. So if they've had a 4th degree tear and it's not repaired very well, or it's not healing, the other thing they can get is a fistula, so it's a hole between the rectum and the vagina. And if they're not healing, then sometimes they're given a stoma to try and allow that area of tissue to heal, and then it might be reversed. So I think for those women it can be much more of a shock, because not only if they come out with a baby, they've come out with a stoma as well.
Two things to look after.
Two things to look after, two things to manage, a massive adjustment. The women that I tend to talk to about stomas are the ones who are a bit further down the line in their journeys, or are starting to realise that the problems are quite significant. And I think a lot of them really want to be able to embrace living as full a life as possible with their kids while they're younger. So, I talk to a lot of women who are in their mid-30s and their kids are under 8 years old, and they're wanting to lead full lives. They've got the incontinence issues and the prolapse issues, and it's like, what do you sort out first? So at the back of their minds, I think they're considering stoma. However, I think there's also the hope that maybe further down the line stem cell stuff will come in. Personally, I don't think it's going to come in my lifetime, which is why I decided I'd go ahead and have the stoma. I think as much as they're making advances in that, it's a complex thing. You might get the stem cells working, but you've got to get the nerves working, you've got to get the muscles working, pelvic floor is damaged, awful lot going on. And I just want to maximise my quality of life now.
Yeah, you've suffered enough. I think you deserve your freedom and your space to be able to do as you please, really.
But going back to advice, I generally tell them, whatever treatment, whether it's a prolapse surgery or something else, go and research it, find out, what the efficacy is, how long has it lasted for, what are the downsides of it, what are the pluses, what to maybe expect, because I've had some of these surgeries myself. So in terms of that, what's the recovery like?
So what kind of work are you doing at the moment? Because you do several things, like you mentioned, you're a fitness consultant, personal trainer, yoga instructor. What are you up to at the moment?
Well, I suppose I have two hats. So I have my own business, which is my personal training and my yoga and all that sort of stuff. And then I've got my sort of charity role where I'm an advocate for MASIC, but I've also become a trustee for them this year as well. So for me, it's one of the things I've been working on is getting a Southeast support group set up. We're setting one up in Guildford, which I'm hugely happy about. So that's really exciting. I'm hoping that we'll have our first meeting in May. And it's something that I really feel that the women need as well. I think it'll be great for them. So support groups, more fundraising. In terms of challenges, well, I'm going to carry on with my swimming, and I like hiking and walking as well. So some sort of peak challenge, whether it's, it won't be the 3 peaks this year, but I might do the 3 Welsh peaks yet.
Oh, nice.
Wonderful.
So yeah.
Yeah, anything is possible at this point.
Anything is possible. There's people out there who run ultramarathons with stomas, people playing rugby. There are some very active Ostomates out there who are incredibly fit. It's having the confidence and just making those baby steps to get started.
Definitely. And even as osteopaths, we talk about how do you educate people about their conditions, even conditions that we might not have to directly interact with or treat. And we never talk about these kinds of injuries or surgeries or operations. And I think if we were better trained, or at least trained ourselves in advising people about, for example, stomas, I think we could contribute more to healthcare by giving some advice if people are concerned in our own realm. Yeah. So I think that's something that I'd like to bring to our side of the table, I think.
Definitely. I think it was interesting looking around the room at the people at the Stoma day the other day, and a lot of them are much older, but a lot of them also have a certain posture. And it's a posture that you see in the general public, quite kyphotic. And I think when you've had any major abdominal surgery, there is a tendency to want to sort of curl up and protect. But again, posture is so important. Breathing, getting people to breathe deeply, breathe into their abdomen. Again, hugely important, rather than shallow breathing up in their chest. Anything that can help, get these muscles working again is really important.
Absolutely.
And in your personal training practice, do you have a lot of people that are ostomates as well, who have come in all with pelvic floor related issues?
Not necessarily pelvic floor related issues, but I think one of the things that's key to remember here is that pelvic floor exercises can also help with recovery from ostomy surgery anyway. In some ways my ostomy recovery was sort of similar in some ways to some of my prolapse surgery recoveries as well, and how I've managed them. Pelvic floor, I think it's really important if you've had any prolapse issues to really work on your pelvic floor anyway. It can be really difficult because there might not be much feedback there. I know you were talking about maybe things that women can do to help, and antenatally, I think for all women actually, and men, because men have pelvic floors too, can't forget that, being familiar with your pelvic floor before you go into having children, and knowing how to contract your pelvic floor and do your exercises properly is really important, because then once you have your children, you have a better idea of maybe when you're trying to get that proprioception and that muscle memory back in. Things are very, very different after having a child, particularly vaginally. So try anything that you can do to try and strengthen your pelvic floor is important. Unfortunately, when you have severe anal incontinence, being told just to do pelvic floor exercises and it will go away is not enough. And that's a common thing I hear. I was given a sheet of exercises and told to go away, and that would stop it. It doesn't always stop it. There's more things that are causing the problems.
And it's also quite a difficult area, maybe not for everyone, but having seen a pelvic floor physio myself, I mean, I was given a sheet of paper and explained how the pelvic floor works, but then, I was trying to do the exercises, and sometimes you just don't know how to make that mind-muscle connection. It's really difficult sometimes. So maybe, as well as information sheets and education about the anatomy of it, just more biofeedback tools maybe, or, things with where physiotherapists are basically hands-on with you, trying to get that feedback from you while they're feeling what you're doing, can be really useful too.
Yeah, so women's health physiotherapists, I think, are really important in all of this, and exactly for that reason. They're the ones who are trained and qualified to actually do that hands-on stuff, to tell you what's going on, because it is very difficult to feel. And the problem with pelvic floor sheets like you've been given, they can also cause some problems too, because if you've got a hypertonic pelvic floor and it's really, really tight and you just keep trying to tighten, you need to actually release those muscles. You wouldn't go to the gym and just continuously do one exercise on one muscle endlessly and then not expect it to sort of have problems and cramp and the rest of it. Right. So again, it's really important. I think there's all this focus on contraction, but actually it's equally important to relax your pelvic floor muscles too. And I myself in the past I know when my pelvic floor muscles have been tight on one side, because it affects the anatomy down the front of my body, and I can feel it into my adductor. It has a massive repercussion on all those lower leg muscles as well.
Absolutely.
Encourage anybody who's having a stoma to do some research, if they've got the luxury of time to be able to research it. And even afterwards, it's really important that you maintain being active, try and lead a healthy lifestyle, because in the long run that will also be better for your stoma too. And just to try and embrace your stoma, really, for whatever reason you've had it, try and see it as a positive thing, because I do think having that positive mindset really does help with adjusting. So that's what I would say.
And we can really feel that. This is why I wanted to talk to you in this setting, because you have your past is your past, but the way that you are living now and the way that you tell your story and come across as, like you've said before, just so hopeful, and it seems like you've found peace in how your body is communicating with you now. And it's really, really encouraging to see, not only in the context of stomas and childbirth injuries, but also in the context of anyone with a health condition, that if you start learning to accept and work with it, it can do incredible things for you.
Yeah, I think acceptance is the thing that probably is the hardest, and I found out a long time ago it was no point being angry and resentful, because the only person it hurts is yourself, and the only person it's eating away is yourself, and it uses up an inordinate amount of energy. It really does. So when you can try and focus on other aspects of, okay, how do I move forward? I can't change what's happened. That's when things start to, I think, that's when the change happens, I think. It's not necessarily at peace, but you've almost parked it for a while. It never goes away. I am aware every day of why I've got my stoma. However, I try not to make that the focus, and it's shifting that focus. And I see a lot of women in my situation who are at the point that I was, where they're very angry and they're very resentful, and I know how draining that is. And again, sort of working with MASIC and trying to put a positive spin on what is a negative situation, all that sort of stuff can be quite cathartic. And knowing that you're trying to help other people and support other people. I've always enjoyed helping people anyway, which is why I became a personal trainer in the first instance. But I think just hoping that you can help them see that there is hope at the end of the day, that you can try and maximise the quality of your life as best you can. And there are dark days, but there are also some very positive days as well.
On that note, thank you so much for taking the time to speak with us. It's been such a pleasure, and I've learned so much, and I have so many ideas of how we can become more educated as osteopaths about these issues, which is so exciting. So thank you so much for speaking with us, and we will see you on the next episode of Table Talk.